Economists expect long-term job growth in all areas of healthcare. But there are some medical careers that will grow even faster than others. They're so-called hot jobs. In these positions, you don't always need to go looking for a job. It may likely come looking for you. X-rays, CT, MRIs, ultrasound. As the technology that allows us to look inside our bodies evolves, so do the career opportunities.
And your doctor's offices are opening, clinics are opening, so it's not only the hospital anymore, it's a lot of other clinics and outpatient work.
Conemaught's Radiologic Technology program is a 2-year program that offers plenty of hands-on care.
Being a trauma center, open heart, RICN, they see everything here, and that's what people like. These people, the students could graduate today and start working tomorrow.
Dion Scott is a certified nuclear medicine technologist.
We will go greet the patient, explain the procedure to them, give them the isotope either through a vein, through an IV, or orally. And in some studies, like for lung skin, they breathe in the radioactive material. It's our job as technologists to conduct good, adequate studies so that the radiologists can come up with the proper diagnosis for the patient.
Dion has a 4-year degree that, like all imaging degrees, focused on the sciences. Surgical technology is another fast-growing healthcare field with exceptional job opportunities.
We're the ones actually handing him the instruments and assisting them on surgeries.
Oh, they're absolutely critical. The surg tech is the person who anticipates the surgeon's every move, has to know every piece of equipment, every bit of the supplies, everything is needed for every type of surgery.
Renee is a graduate of Conemaught's 2-year surgical technology program and works at the Lee Ambulatory Surgery Center, where the variety of cases, everything from eyes to dental cases to foot surgery, keeps things interesting.
I always wanted to do something in the healthcare field, and I thought I'll try surgical tech, and when I walked in the first day and was in the operating room, I was like, this is the place for me.
Like other healthcare careers, a rising baby boom population has led to a boom in the demand for pre-hospital providers like EMTs and paramedics. This paramedic class at Memorial is broadcast to 7 other sites, a benefit for those already working as EMTs.
It's allowing a lot of the rural communities to have access to paramedic education and come to class, and as soon as they finish up with the class, they are then able to go right back to work if they need to.
The 11-month paramedic program involves 400 hours of classroom study and 400 hours of clinical training in a variety of hospital departments.
We start out with anatomy and physiology, learning where things are located and how they work, and then we go on to learn everything from cardiology to respiratory care to how to start IVs, how to intubate people with just put a tube down their throat.
It is very demanding, both physically and mentally. You don't get a lot of sleep at times, but it's definitely an adrenaline rush, and I think that most people that are in here are into it for the challenge.
I love it. I love it. I love being able to actually get in the back and treat people, help people, and just see them very, very bad shape and being able to turn them around quickly. That's a great feeling.
Those graduates from the Conemaugh School of EMS who become certified as a paramedic have a 100% employment rate. Chris Gambita likes helping people and always knew he wanted to get into medicine.
I decided that I wanted to do something where I didn't really have to work as much with blood and guts.
Physical therapy fit the bill. Now director of both inpatient and outpatient physical therapy at Meyersdale Medical Center, Chris loves the variety.
One time I'll have a patient come in that has a neck injury. The next minute I'll have, the next person comes in has a shoulder injury, then has a knee injury, and then somebody comes in and has a balance problem. So you're seeing so many different things within that same field of study that you need to be up on everything.
Chris also loves that his field really allows him to get to know his patients.
I mean, I'll see a patient for sometimes a month, 2 months, 3 months, where you'll see him a couple times a week. So you really have to be able to relate to people.
People like Richard Donaldson, an avid hunter whose tree stand broke, sending him into a 20-foot fall that shattered both ankles.
I couldn't pick my leg off of the bed. I couldn't bend my knee. I couldn't move nothing.
But after months of physical therapy, fairly simple movements at first, Richard is making great progress.
A little thing like stretching you would think would be so silly, just a stretch of a band or whatever on your foot with a little bit of resistance behind it. But it means the world. It means walking or not walking for me.
This part of the job is being able to see somebody actually succeed. Someone who could not stand up and walk, now being able to walk.
Most physical therapy degrees are now doctorate-level programs, requiring an additional 2 to 3 years after an undergraduate degree.
There's never a lack for a job. You can work 2 or 3 full-time jobs if you really wanted to. There's so much demand out there.
Like physical therapists, pharmacists are also in hot demand with ever-increasing opportunities.
The ideal type of candidate for a career in pharmacy is somebody with good communication skills who really wants a direct patient care responsibility, because that's where the growth in the jobs are and will continue to be in the future.
I love working with patients.
That love of hands-on patient care convinced Neela Bajanis to give up her career in retail pharmacy and head into the hospital setting through Memorial's competitive one-year pharmacy residency.
So the residency program is structured to provide a mentored additional year of education that provides direct patient care.
Neela spends her morning rounding with physicians, an important member of the patient's care team. Back in Memorial's pharmacy, these pharmacists are working to fill more than 3,000 prescriptions a day, always with an eye for potential problems.
They look for drug interactions, they do allergy assessments, they look for dose appropriateness.
Another important part of the team, pharmacy technicians.
This is an evolving field. It's a group of individuals that assist the pharmacist in the daily activities.
You can be a consultant for a physician's office. You can work for a pharmaceutical company. You can work in the research department. There's just so many different fields of pharmacy, which is so great, and that's what I love about pharmacy.
For information on the pharmacy and the rest of these hot jobs, check out our website.